I'm going to talk about microsurgery and reconstruction at Duke, which is a big task. Obviously, that's been a major part of who we are here. And as Curtis will tell us, we are walking on the shoulders of giants. So Duke Reconstructive Microsurgery, this is a picture just from this week, actually, in the operating room with me operating with one of our rising chief residents. And this really summarizes what we're about. That is patient care, education, research, innovation, and leadership. And that's the idea behind Duke Microsurgery. We've heard about this from Dr. Futrell earlier and others. Jim Urbanek really has been instrumental in bringing microsurgery to Duke. Dr. Urbanek also instrumental in my own development here with us at a microsurgery workshop. He's been a great mentor for me and many of us in this room. Dr. Urbanek, as you know, is one of the founding members of the ASRM. So I wanted to point out Jim Urbanek and his contributions. But really, in terms of plastic surgery, Dr. Serafin, who's here in the audience with us, is often credited as developing microsurgery at Duke. And he's well known for his publications and his textbook, which many of us would acknowledge was the standard textbook, which all others were measured against for many years in reconstructive surgery. I did want to point out Dr. Barwick, Bill Barwick. We do have a lecture in his honor, and you can see here from 2016 we had Louis Vasquez. We heard about Dr. Vasquez earlier today. These are pictures of Dr. Barwick during his training, so we continue a lecture which is generally microsurgery based in his honor. No talk about microsurgery at Duke would be complete without mentioning Dr. Levin. Dr. Levin, as we heard, was a charismatic leader of our division for quite a while. He helped train me. That's me graduating with Dr. Levin and my co-chief residents. This is him recently. As you know, he became well known for his pediatric hand transplant case. And really, Dr. Levin's mark on microsurgery is probably best summarized through the creation of the Duke Flap course, which started in 2003. And it was his idea, perhaps with others, to develop a fresh tissue lab, which would allow us to go to the lab and do active dissections and actually bring a course here. And he brought in well-renowned faculty from all over and developed this. And we've seen even this picture earlier today of Dr. Gunter German. And then I'd have to mention Dr. Zen, who really took over the flap course with Dr. Levin's support and really took it to the next level. Dr. Zen, here in the audience with us, was one of my main mentors and microsurgical teachers, so I truly appreciate everything he taught me. Dr. Zen, very well known for his now state-of-the-art book in flap dissection. Here he is in the flap course. In 2017, it was really my honor, along with Detlev Erdmann, who's here in the audience with us, to be able to take this course and try to evolve and go to the next level. That's a big deal. It's like becoming the manager of the Yankees or something like that. We really were honored to be part of this. And we invited some new faculty, and we moved to a new area to do the lectures, and we even have a little banquet. But we still continue to be based primarily on excellent flap dissections. And so the course is doing very well. We're looking forward to the course in August, and we've already sold out with many, many people on the waiting list. I did want to take a moment to mention Clint Lewicki. Maybe some of you knew Clint. Clint was really a critical part of Dr. Levin's vision of setting up the microsurgery or the flap course and the fresh tissue lab. And Clint's been a key part of the flap course for many years. Unfortunately, Clint died this past year, unexpectedly somewhat, and so we're going to honor him this year at the flap course with the first ever Clinton Lewicki honorary lecture. So I think I did want to take a moment to honor Clint here. After Dr. Levin, Dr. George Ade really took over and really helped inspire us to grow in microsurgery in new ways. And I would say Dr. George Ade's contribution has been primarily in regards to education, where he focused on how do we train people, how do we teach people microsurgery. And one of the things we did is we've had these simulator setups for many, many years. And then we eventually moved into some space here where we have multiple microsurgery stations, and this gives us the opportunity for residents to train and do actual anastomosis in a controlled setting on synthetic blood vessels and learn how to operate the microscope and develop the skills that are necessary to come to the operating room. As we've heard now, we have younger trainees. We don't have people that have finished prior residencies. They need all the time they can get doing this sort of thing prior to coming to the operating room to do their first complex case. So this has been very helpful. Additionally, during Dr. Georgiade's era, Dr. Sandalis joined us, and I don't want to take away from her talk, but she's going to be speaking next. But I did want to point out that her contribution is also key to our resident education in microsurgery, where she's organized a very high-level animal flap dissection course and anastomosis course, and so I wanted to acknowledge her contribution as well. And then something we started in 2004, and this has been a lot of fun, and I want to take a few minutes to talk about this, is a microsurgery course that we started with Johns Hopkins. And one of my good friends, Justin Sachs from Johns Hopkins, came here, and we did a day where we taught our residents microsurgery. And we had a little party, and we handed out some certificates, and I thought that was the end of it. But then the next year, he invited me and a bunch of our residents to go up to Johns Hopkins. And so I took 7 or 8 of our residents, many of whom are here in the room. We had a great time, drove up to Baltimore, spent the day in their dissection lab, and did some cadaver dissections, and really began to grow that course. And then we actually had it back in Durham in 2016. This time I invited residents and faculty from Emory, Vanderbilt, Harvard, again from Johns Hopkins, and Wake Forest and UNC for this course. And here you can see a number of those residents and faculty members here. This is a group of the Emory residents getting on the plane. And the concept of this is that everybody gets together and works together as a team, goes somewhere together and learns, and then goes back. So it's team building. There's a lot of networking that goes on with the events, and also education. Here we are in the microsurgery training lab. And then this last year we went to Denver, Colorado, where we had, again, a group from both the Mountain West area as well as the core groups of Duke, Johns Hopkins, Emory, Harvard, and Vanderbilt. And here we are again doing cadaver dissections, again, some networking, but you can see that there's quite a bit of education. Research, I'm not going to go through every paper, but these are papers based on microsurgery and reconstructive surgery done in the last 4 years through our group. A number of papers in PRS and Journal of Microsurgery, and many different topics, breast as well as lower extremity. I believe we are well published. Again, this is just from the last 4 years. And I did want to mention, oh, it's too bad, I lost a slide somewhere. I did want to briefly mention the clinical programs. Probably the one we're most active in is breast reconstruction. We do quite a bit of breast reconstruction. Dr. Marcus alluded to that earlier today. Head and neck, we heard some questions from the audience. In my opinion, that remains a significant challenge. We try to partner with the ENT service, but getting those cases is quite difficult, and we're hoping that Brett can help build that program. Facial reanimation is very strong. We heard about that earlier. Dr. Zen and Dr. Marcus really pioneered that, and we're nationally, if not internationally, known for their work in facial reanimation. Brett Phillips will be helping us with that as well. We have a strong history of lower extremity reconstruction, mainly with Dr. Levin's efforts. We continue to try to grow that back to what it was when he was here. Upper extremity is a lot of trauma at Duke, so these are mostly trauma cases, but Dr. Sandalis will talk to us about transplantation. We also do a fair bit of trunk and lymph node microsurgery, so it's quite an extensive array. So under Dr. Marcus's leadership, this is the future. And we heard about some new hires that we have coming, and I won't go through that as he outlined that, but we're really excited about the future that we have here. A lot of these folks will be bringing new techniques, new skills that they've learned as they've gone to their other institutions. Brett to MD Anderson, and Sharon out on the West Coast, and Kristen with her multiple areas of experience. That we think will make us better by having an excellent team. We heard that concept, the best teams have the best players, and I think our last talk by Dr. Alori really showed that. So I think that's all I have. I did want to mention briefly The medical students we have here and the papers I showed, I had meant to show everybody's participation in that, but many of the people in the room, those papers don't happen without the contribution of the residents and also the medical students. We haven't heard much about them today, but over time, the medical students have become a bigger and bigger part of our division. It's not the same process where they apply to become a part of the division, but they show interest and they participate by writing papers. And more commonly, medical students are taking extra time during medical school to actually do research and become educated. And those papers that I showed are due to the hard work of those medical students as well as the residents, many of whom spend their weekends and nights writing these papers, and that's what it takes. And I hope Dr. Pickrell would be proud of the work we've done in microsurgery the last 4 or 5 years. Thank you.